Thank you guys so much for the warm welcome. I'm excited to talk to you today about reimagining our healthcare system. But the story starts for me quite a while ago. I became a vegetarian when I was 16, a really long interest in healthy eating. Ate my first organic produce at the Ann Arbor Food Co-op in the mid-'70s. Like some of you, I have a dog-eared copy of Francis Moore Lepay's Diet for a Small Planet on my shelf that I still use. And then in my 40s, I started and ran a home-delivered meal service here in Sonoma County called Speranza from 1993 to 2003. And then in 2006, I got a phone call that changed my life. My horseback riding teacher called, and she said to me, "My daughter Megan needs to get a job over the summer, and I want her to learn how to cook, and I want you to hire her." So I had the same reaction you just did. I didn't have a job opening for one thing, but it's hard to hire someone for a cooking job that doesn't know how to use a knife. That is a problem. But this mom was pretty persistent, and I have a tendency to want to help. And so a couple weeks later, I remembered that a good friend of mine was helping a family in Sebastopol. The mom was stage 4 metastasized breast cancer, and there were a couple of preteens in the family. So I put a small project together that summer, and one afternoon a week, Megan and I got together, and I taught her how to cook, and we made meals for that family, and for 2 other families that I had found who were also struggling because of a health crisis. The first day that Megan and I cooked together, the dad in this family stopped to pick up the meals. It happened to be on his way home from work. And I had never met him either. So I introduced myself and I introduced Megan, and I was just making small talk. I started sharing what we had made for them. And what I know now is in that family, everyone is terrified. And the parent who's well has this enormous burden. He was not only working full-time, he was also caretaking for his wife and trying to keep some semblance of normalcy for the children in that family. And as I was talking, you could see the utter relief in his whole being that someone was even providing this tiny bit of support for them. And in that moment, I glanced over at Megan, and she was about 6 inches taller. It came and went, the moment came and went, but 3 weeks later, I woke up at 6:30 in the morning with a vision for what has become Ceres Community Project. Teens just like Megan would come into the kitchen and learn about cooking and eating healthy food. And the meals they made would go to families in our community who were struggling because of a health crisis, just like that family with the mom who had stage 4 metastasized breast cancer. Seems like such a simple idea. So over the last 12 years, about 4,000 families have benefited from our work here in Sonoma County and also Marin, and about 3,000 young people have become part of the program. And what I've learned is that most of the clients that we serve would never have had healthy food to eat without us. There's a whole host of reasons. Many of them live alone without a support system. They're too sick to shop and cook, and most of them are poor, and that makes a difference. Over the last 12 years, I've learned a lot about the difference that healthy food can make for people like our clients. I'm going to talk about some of the numbers, and while I do, I hope you'll keep these faces in your mind, because these are about real people. 42 million Americans are food insecure, and that includes 13 million children. Food insecurity means that people don't have enough to eat, they don't have enough good food to eat, and that makes them sick. And in fact, it's costing us $77 billion a year in unnecessary healthcare costs. And 60% of deaths in the US now, one of the wealthiest countries in the world, are related to poor diets. I mean, just stop and think about that. I was talking to someone at my gym this morning, and she said, 60%? And I said, yeah, 60%. 60% of deaths in the US are related to poor diets. We are simply eating ourselves sick. And the other thing we're doing is we're radically underinvesting in food. If you think about school lunch, you think about the Older Americans Act, you think about WIC, you think about food stamps, we're radically underinvesting in those programs, and this is what's happening. Now, the good news is, there's one other thing that I want to share. The other thing that's really interesting is only 10% of our health outcomes are related to what happens in the doctor's office or the treatments that your doctor can prescribe for you. That's the same amount as our genetics. 30% are related to the choices you and I make every day. It's the good news and the bad news. The choices that we make every day in our own lives, in our day-to-day lives. But more importantly, 40% are the social determinants that limit and constrain those choices for those 42 million Americans who are food insecure and many others. So that's pretty astonishing. The good news is there's a quiet revolution happening around the country, really challenging the idea of what healthcare should pay for and should prescribe and pay for. And the field is really being led by a coalition called the Food as Medicine Coalition. So these are agencies who provide medically tailored meals to people who are dealing with serious illnesses. They began during the AIDS epidemic in the mid-'80s, and they have 30 to 35 years of experience now providing meals to that population. And Ceres is really proud to be a member of that group. And over the last 5 or 6 years, that group has started to do significant research studies on the difference that it makes when people get food. So it's not rocket science, right? When people have quality food as part of their treatment, they feel better and they do better. And what that means is they're less likely to end up in the emergency department. They're less likely to be hospitalized. And when they are in the hospital, they're much more likely to be discharged to home instead of a skilled nursing facility. And all of that saves money on the healthcare side. What we're finding is somewhere around 16 to 20% net savings in the healthcare field. Now we're taking that research to the next level here in California, and thanks to the California legislature, we've just been awarded in the last year $6 million to conduct a 3-year research study with Medi-Cal patients who have congestive heart failure. So Ceres and 5 other agencies across the state, from San Diego all the way up to Sonoma County, are part of that study. Over the next 3 years, we're going to be providing 1,000 Medi-Cal patients with 12 weeks of home-delivered meals and 4 visits with a registered dietitian. And we'll be measuring the impact of that on their health outcomes and comparing that to 4,000 similar patients. So unfortunately, in order to change policy, we have to show that there's cost savings. And so in some ways, it comes down to the numbers. So remember, we said 16% net savings in the studies that have been done so far. Here's just a very conservative estimate of what this might mean in California. So if we can save just 5% net savings on the healthcare cost side, when you translate that across 57,000 hospitalizations for heart disease in California, you're talking about almost $100 million a year in cost savings. But like I said, this isn't about the dollars. This is about real people. And I'm really excited to share a very short video of Candace. And I want to thank Candace for being willing to be interviewed. That's a really hard thing for someone in her situation to do. And I also want to thank Project Angel Food in LA, our colleague organization who served Candace. We don't.
It's been a really tough struggle for my life for the last 5 years. I've dealt with amputation, having really bad battles with infection. Congestive heart failure for me was like, I couldn't breathe. I couldn't lay down flat and breathe without feeling like I was like drowning. My legs were extremely heavy, just tired. It was very scary because I wasn't sure what was going on. Basically, the doctor told me your heart is failing and there's fluid backed up in your body. The first time I was hospitalized for about 7 days. For a while, yeah, it was weeks at a time. And then I would come home and I would need in-home nurses and things because I always had like PICC lines. I mean, I have a lot of scars you can see from having tubes inserted here and there and PICC lines and tunnels and things, just trying to keep myself alive. My family, everybody works. Everybody's got kids, everybody's got something to do. And it seemed like every time I would get sick, my family would have to stop what they were doing and rearrange their lives just to be able to be there for the kids or me. It's been about a month now.
No hospital?
No hospital, because I only eat what they give me. And so far, I've been out of the hospital. I haven't been retaining excess fluid. I've been dropping weight. You know, it's working. It works. It really works.
So Candace is just one of the many patients that we've served so far in this study. And I just think it's really important to think about what her life is like and what her life has been like, and even being able to see the difference in how she looks from having gotten this food. Clearly, Candace is already really sick. And one of the things we're also learning is that food can make a big difference even earlier along what we call the prevention treatment continuum. So this is a statistic I learned a couple weeks ago that is just kind of blowing my mind. So among Medicaid patients, they are 27% more likely to go to the emergency department the last week of the month. Can you figure out why? They run out of food, and they skip meals, and many of them are diabetic or pre-diabetic, and they end up in the emergency department. The good news is that there's already some work being done to look at a food insecurity intervention for that. So there's a lot happening in the healthcare field around this. So back to those faces and back to Ceres. The truth is that nonprofit organizations like us will never be able to raise enough money to feed everyone who needs it, to provide this kind of support. In order to do that, we have to change policy. We know from our clients that a meal prepared with love is one of the most powerful ways we can show that we care. And it's, you know, delivering a meal, it's real and it's tangible, and that's an easy thing to do. Policy seems like something abstract. But my realization is that policy is how we put our values into action. Policy is how we make those meals available to people like Candace and to people across the state. So the research is mounting. There's clearly enough data now to say that this is something that we should be doing, but it's going to take all of us raising our voices. Talk to you now know about this, so share it with your doctor, share it with your insurance company, share it with your legislators. Together, if we can raise our voices, we can change policy so that food becomes available to everyone when they need it most, and we can truly reimagine our healthcare system. Thank you so much.